Welcome to the ALS Care for the Caregiver's first video recording. This episode will cover body mechanics, putting on a gait belt, as well as transfers from supine and sitting at the edge of the bed, squat and stand pivot with and without pivot discs. Please note that the information and demonstrations being provided in this recording are designed for general educational purposes only. This recording is not a substitute for medical advice. Each caregiver and/or patient should be seeking the guidance from their personal physician and/or personal healthcare team regarding which devices or transfer techniques are safest for them.
Take note of the bend in the knees, straight back, tight core, and close contact seen with the good body mechanics, while the bad body mechanics shows straight legs, a hunched back, and outstretched arms, which increases the risk of a lower back injury and likelihood of losing control of your loved one. To apply the gait belt, your loved one should be in a safe and secure position. When your loved one is laying on their back as shown, slide the gait belt under their waist and thread the gait belt through the teeth of the buckle. Make sure the gait belt is snug against their midsection but not too tight where it's hurting them, or not too loose where the gait belt is sliding up and down their waist. About 2 fingers should fit in between the gait belt and their waist. Lastly, slide the belt through the loop to secure it and tuck away the excess under the belt.
The next transfer we'll be doing is a supine to sit transfer. First, have your loved one lying supine on the bed. Have them bend up their left leg as we're turning to the right side so their foot is flat on the bed. Have them reach with their left hand to the right for the edge of the bed. Place your hands on their left hip and their left shoulder, or you can put it on their left knee. Ask your loved one to push off with their leg and pull with their left arm at the same time as you help them move as a unit to position them on their right side. Make sure your loved one's right arm is not under them and won't get pinched. You may need to move their arm if needed. Assist the loved one by lowering both legs off of the bed. Have them do as much as possible. As the legs are lowering, ask them to walk themselves up with their arms. Here you'll see that same transfer from a different angle. We will now be performing a squat pivot transfer. To begin, place the wheelchair on a 90-degree angle to the bed, and you can either choose or choose to not take off the armrest closest to the bed. Be sure the wheelchair brakes are locked before beginning the transfer. As the caregiver, be sure to communicate with the patient to make sure that you're on the same page with the tasks that will be performed. Ask your loved one sitting at the edge of the bed to scoot forward enough so their feet can be flat on the ground. Next, have your loved one place their foot closest to the wheelchair, slightly out in front of the foot farther from the wheelchair. The foot farthest from the wheelchair should be tucked slightly underneath the bed. As a caregiver, place your feet hip-width apart, slightly staggered, and get in a good squat position. Keep your loved one close by having them lean forward. Grab the sides of the gait belt or the pants of your loved one and stay in a good squat position. Count to 3 out loud, and on the count of 3, assist your loved one up and over to the wheelchair while you both have your knees bent. Sit them down slowly and in a controlled manner in the wheelchair and place the armrest back on the wheelchair and unlock the wheelchair, ready to go. We will now watch the squat pivot transfer from a slightly different angle. The next transfer we will show is a squat pivot with the pivot disc. This transfer is set up exactly as a traditional squat pivot transfer is set up. However, instead of staggering your loved one's feet, place both feet directly next to each other on the pivot disc. The pivot disc is used to help assist the lower extremity with the transfer. Count to 3 out loud and help to transfer your loved one to the wheelchair as you would with a traditional squat pivot transfer. Be sure to communicate with your loved one accordingly. If they end up too far forward in the chair, have them use their upper extremity if possible to push back.
This is a stand pivot transfer. Approach your loved one in front of them and make sure they are sitting near the wheelchair. Have them scoot forward on the bed so just their butt is on the bed. Reposition their foot near the wheelchair to stagger slightly ahead of the other foot, like shown, with both feet flat on the floor. Grab the outside of the gait belt with your palms facing their body. Make sure to straighten your back and bend your knees to prepare for the transfer. Tell them you are going to have them lean slightly forward at their trunk. On the count of 3, they are going to push through the heels of their feet as much as they can while you assist them to a standing position. When standing up, they will turn their feet toward the wheelchair with their back to the wheelchair and their thighs touching the wheelchair seat. Have them sit down slowly while you assist them to a seated position. This is a stand pivot transfer with a pivot disc. Approach your loved one from the front and place the pivot disc on the floor, a foot from the edge of the bed. Make sure the wheelchair near the bed is locked. Place both of their feet on the pivot disc with their feet flat and toes pointed forward like shown. Grab the outside of the gait belt with your palms facing their body. Have your loved one scoot forward on the edge of the bed. Tell them that you are going to have them lean slightly forward at their trunk. On the count of 3, they are going to push through the heels of their feet as much as they can while you assist them to a standing position. When standing up, the caregiver will rotate their loved one toward the wheelchair and slowly lower them to a seated position.